Well, welcome back to Tampa Bay's Morning Blend. As we have mentioned before, there are healthcare needs outside of COVID-19. We know COVID-19 and the coronavirus is getting a lot of attention, but that doesn't mean that some other health factors should not be at the forefront of your mind. This morning, we are talking about vein disease and varicose veins. And one of the leaders in the treatment options, of course, is Dr. Wazni of United Vein Centers, who we've had in studio several times. So happy you're able to link in with us through this new format, this new normal that we're all kind of dealing with. Good morning, doctor.
Good morning. Thank you.
How are you and your team doing?
Great. Moving through, staying positive.
Yeah. So it's interesting. We were talking about vein disease right before we got started, and it's not necessarily, which is kind of bizarre because I feel like we've talked about this a lot, that it's not necessarily the procedure for it, an essential, procedure that may need to be done. But this is a big issue for people. Talk about vein disease and varicose veins and why it's not really just a cosmetic issue. I mean, this really could be a health concern for people.
Correct. Now, the physicians at United Vein Centers do not treat cosmetic veins. Cosmetic veins may be treated by, say, medical spas or dermatologists or plastic surgeons. The surgeons at United Vein Centers specifically treat vein disease, not any cosmetic veins. And this is a vein disease that causes pain, aching, swelling in your legs, sometimes leg ulcers, and these things can lead to blood clots. So these physicians concentrate specifically on the medical aspect of vein disease.
Yeah. So as I mentioned, you're one of the leaders, I believe, in the treatment for this. Talk about the new normal that your team is having to know and operate around as far as patient safety. And I'm assuming that it is safe to come in and get this taken care of.
It is safe, correct. And in healthcare, we're used to routine disinfection of surfaces, keeping everything clean. Now, with COVID, we do not want to contribute to any increase in cases. We'd like to see it go away so that we can all concentrate on our health. So we continue to disinfect and clean surfaces, tables, chairs, doorknobs, and any touch points. Now, when patients come into our office, we've limited it so that there isn't any more than one, maybe two patients in the waiting room. As a matter of fact, we're doing our best so that when a patient comes in, we immediately put them in a room rather than have them wait in the waiting room. We've increased our times. Everyone gets a face mask, patients, staff, everyone gets a temperature check. When you come in to see us, you'll have a temperature check. Now, the good news is that taking temperatures is very effective. About 88% of patients who may have COVID will have a temperature. So we'll check staff temperature daily and patients. In addition to that, we'll screen our patients on the phone prior to their appointment and during their appointment to ensure that they do not have any symptoms of COVID.
Yeah. Less than a minute here. Again, I really want to stress if this is, especially if people are in pain or if they're suffering right now from these varicose veins, how important is it that you do make that appointment, come in and see you and have this taken care of?
If you're having pain, aching, and swelling in your legs or restless legs at night, it's important that you come in and see a vein doctor. Reason being is that vein disease, if left untreated, like many diseases, it gets worse. It could lead to blood clots in your legs, which could be deadly. It can lead to ulcers. And for these reasons, all health insurance, including Medicare, Blue Cross Blue Shield, these health insurances do cover the treatment of vein disease because if left untreated, it can lead to complications.
That was literally the thing I was going to end with as well. I'm glad you brought that up. Doctor, thank you so much for your time. We wish you and your team all the best. Keep us updated, and we hope to talk with you soon. Again, there is the website, the number to call. But again, don't put this off if this is something that has been bothering you. Thank you, doctor.
Thank you.